Premature, also known as preterm, birth is when a baby is born too early, before 37 weeks of pregnancy have been completed. The earlier a baby is born, the higher the risk of death or serious disability. Preterm birth and low birth weight accounted for about 16% of infant deaths. A premature birth is a birth that takes place more than 3 weeks before the baby's estimated due date. In other words, a premature birth is one that occurs before the start of the 37th week of pregnancy. Depending on how early a baby is born, he or she may be late preterm, born between 34 and 36 completed weeks of pregnancy. Moderately preterm, born between 32 and 34 weeks of pregnancy. Very preterm, born at less than 32 weeks of pregnancy. Extremely preterm, born at or before 25 weeks of pregnancy. Do all premature babies need NICU? Although every baby is different, in most cases babies born before 36 weeks of gestation require a minimum of 1 day of observation in the NICU before they are transferred to the postpartum floor to stay with you. Symptoms of premature babies. Your baby may have very mild symptoms of premature birth, or may have more obvious complications. Some signs of prematurity include the following: small size, with a disproportionately large head. Sharper looking, less rounded features than a full-term baby's features, due to a lack of fat stores. Fine hair, lanugo, covering much of the body. Low body temperature, especially immediately after birth in the delivery room, due to a lack of stored body fat. Labored breathing or respiratory distress. Lack of reflexes for sucking and swallowing, leading to feeding difficulties. Often, the specific cause of premature birth isn't clear. However, there are known risk factors of premature delivery, including having a previous premature birth, pregnancy with twins, triplets or other multiples, an interval of less than 6 months between pregnancies, conceiving through in vitro fertilization, problems with the uterus, cervix or placenta, smoking cigarettes or using illicit drugs, some infections, particularly of the amniotic fluid and lower genital tract, some chronic conditions, such as high blood pressure and diabetes, being underweight or overweight before pregnancy, stressful life events, such as the death of a loved one or domestic violence, multiple miscarriages or abortions, physical injury or trauma. Although the exact cause of preterm birth is often unknown, there are some things that can be done to help women, especially those who have an increased risk, to reduce their risk of preterm birth, including progesterone supplements. Women who have a history of preterm birth, a short cervix or both factors may be able to reduce the risk of preterm birth with progesterone supplementation. Cervical cerclage. This is a surgical procedure performed during pregnancy in women with a short cervix, or a history of cervical shortening that resulted in a preterm birth.